because of a fundamental misunderstanding. Today, I want to lift the veil on that misunderstanding. I want to dig into the truth about root canals, to explain what actually happens during the procedure, what pain is actually involved, and how much of our collective fear is based on outdated practices, secondhand horror stories, and pain that actually comes not from treatment, but from the reason you needed it in the first place. So, what's the core misunderstanding about root canals? When people say I had a root canal and it was horrible, what they usually mean is that they were in horrible pain before they ever sat down in the dentist chair. Now that pain, that pounding, sharp, relentless kind of agony that radiates from a deeply infected tooth or a nerve that's been inflamed or traumatized, that pain is what drove them to the dentist. It's not the pain of the procedure. But over time, in conversation and in culture, the cause of the pain and the fix for it have become confused. The root canal gets blamed for what the infection did. It's like blaming the fire department for the fire. A root canal is a methodical and highly effective way to preserve a natural tooth that's been compromised. Usually that occurs by decay, trauma, or infection that's reached the pulp of the tooth. The pulp is the outletting center where all the nerves and the blood vessels reside. Now the pulp is surrounded by hard layers of dentin and enamel, but when bacteria find their way in through a deep cavity or a crack in the tooth, they invade that soft inner tissue. The immune system tries to fight it off, but with nowhere for pressure to go and no circulation to truly carry immune cells in or out, the result is a buildup of inflammatory pressure and bacterial toxins that trigger intense pain. Now, enter the root canal, not as a villain, but as a hero that steps in to save the day. The goal of the procedure is not to cause pain, but to relieve it. And for most people, once anesthetic is administered and the procedure begins, that pain begins to subside. That's the part that rarely makes it into the horror stories. The procedure is actually not that painful at all, especially when performed by skilled hands using modern techniques and local anesthetics. Many people report that getting a root canal feels no worse than having a routine filling done. So, what actually happens during a root canal? Well, once the dentist determines that the pulp of the tooth is diseased or dead, they'll begin by administering a local anesthetic, typically something like lidocaine to numb the area. And here's where we should pause, because the role of modern anesthetics is essential to understanding why root canals aren't nearly as painful as they've been made out to be. See, lidocaine and its relatives work quickly and effectively. Within minutes, the entire area is completely numb. You may feel pressure during the procedure, and you'll be aware that something's happening. But as far as actual pain goes, that's almost entirely eliminated. Now, once the area is numb, a small hole is drilled into the crown of the tooth to give access to the pulp chamber and the root canals below. Through this access point, the flexible files are designed to clean out the canals thoroughly, removing debris, bacteria, and any dead material. All the while, the canals are irrigated with disinfecting solutions, typically sodium hypochlorite, which help flush out debris and kill any lingering bacteria. This part of the process is crucial to the success of the procedure, as leaving behind any bacteria can result in ongoing infection. Now, once the canals are cleaned and shaped to the appropriate size, they're dried and then they're filled with a biocompatible material, usually a rubbery substance called gutta perca. This material seals the canals to prevent any future bacterial invasion. A temporary or permanent fillings then going to be placed over the access hole, and eventually the tooth usually is completely restored with a crown to protect its structure and its function long term. The entire process can take one or more visits depending on the complexity of the case, but for many people it's over in a single sitting. And most importantly, the sensation of relief often begins during the procedure itself. That pressure that's been building up in your jaw, that throbbing ache that won't let you sleep at night, that begins to fade as soon as the nerve tissue is removed and the infection source is cleaned out. So, it's ironic, really, that the procedure we so often associate with pain is, in truth, the one thing standing between you and that pain's continuation. Now, let's talk about the aftermath, because the recovery period is another place where people confuse things. After a root canal, there is indeed some soreness. The area may feel tender for a few days, but it's not the kind of pain that demands anything more than an over-the-counter remedy. Typically, ibuprofen or acetaminophen is all that's needed to manage that discomfort. In fact, that soreness you experience is usually from the inflammation of the surrounding tissues that were irritated before the root canal ever started. It's like your body's still calming down from the infection that prompted the whole situation. The actual procedure's done, the nerve's been removed, the infection's cleaned out, but your tissues are still healing. And just like any other healing process, it takes a little time. And here's the thing, it's healing pain, it's not escalating pain. The sharp, unrelenting pounding sensation that you had before that root canal, that's gone. What you have instead is a dull ache, mild soreness, maybe a little sensitivity when chewing. But that gets better. Day by day, the tissues settle down, the inflammation resolves, and your normal life resumes. The worst part is behind you the moment the root canal is completed. Now, contrast that with what would happen without a root canal. Left untreated, an infected pulp doesn't just go away. It can form an abscess, a pocket of pus that forms at the root tip and can spread infection to the jawbone and the surrounding tissues. In severe cases, it can lead to systemic infection, swelling of the basic neck, fever, and in some cases, even life-threatening complications. So, in a sense, the root canal isn't just saving your tooth, it's protecting your overall health. Yet, despite all this, the myth persists. Why do root canals continue to carry this outsized fear in the public mind? Part of it source of suffering. It's the end of pain. It's not the cause. And the more we educate ourselves about the reality of the procedure, the more we can free ourselves from the shadow of that old reputation. So, next time someone around you groans at the mention of a root canal or jokes that they'd rather do anything else, maybe take a moment to reflect on what's really happening there. Maybe remember that the pain they're thinking of isn't the procedure, it's the problem the procedure's fixing. And maybe you'll feel a little more empowered if you ever find yourself in that chair, knowing that what's ahead isn't punishment, but relief. Because dentistry has come a long way. Pain management is real, and root canals don't deserve the bad rap they've gotten for far too long. They're not monsters under the bed. They're more like paramedics, rushing in when things are at their worst, doing the hard, precise work to set things right again, then quietly disappearing from your life once the job is done. If you enjoyed this video,